Welcome to the Maine Science Podcast. I'm Kate Dickerson. Today's episode is a conversation I had with Kelley Strout, an associate professor of nursing at the University of Maine. Kelley's doing really remarkable work addressing burnout for nursing students. And I was struck in our conversation not just by Kelley's passion in her research, but also how much of her research has applications across disciplines. Our conversation was recorded in January 2026. I hope you enjoy it as much as I did. Today's episode of the Maine Science Podcast is brought to you by Bangor Savings Bank, committed to supporting scientific exploration and discovery in Maine. Kelley, welcome to the Maine Science Podcast. We've known each other for a bit, and I realized at some point recently that I don't think people realize there's research going on in nursing, right? Like we just have a set idea of what nurses are, probably formed entirely by people's image of Florence Nightingale and beyond. And I thought we need to have a conversation to talk about your background and what it means to do research in the context of nursing. And I realized we're only going to grab a sliver because you don't do all the research for all the nursing everywhere. But before we get into that, I was kind of hoping you could give me a quick background about how you got into interest in actually doing research while you were, as a nurse, initially trained.
Yeah, great question, because when I graduated nursing school, I never in a million years would have thought that I would become a nursing scientist or earn my PhD, or I never had that vision for my life. You know, some people, they grow up and they want to be a doctor, they want to be a scientist, and they know that. I did not. I was not one of those people. And what happened was I took my first job on a cardiac telemetry unit, a local hospital, and almost immediately, I realized that our healthcare system was flawed and backward. And we'd have patients coming in with high blood pressure, high cholesterol. And at the time, of course, this was, 20 years ago, they would have recently been to a primary care provider, or they would have a value in their chart that they didn't necessarily know that they had these high elevated risk factors for having an acute cardiac event. And I thought, wow, this whole stay could potentially be preventable. Not only that, but we are very good in our healthcare system at treating problems once they become a crisis, health issues. We have complex medications and surgeries and procedures, but we're very bad, and we're still very bad at preventing disease in our communities. So I found myself really interested in well-being and wellness program development and prevention. And I ended up taking a job as a wellness coordinator. At the time, we had a contract with Jackson Labs, so I worked with their employees on wellness coaching, and we would complete biometric scans and talk to them about their health risk factors and develop goals, and it was really fun. And throughout this process, I wanted more science from the nursing perspective on how to best work with patients from a preventative standpoint. And what I learned is that most of the science in prevention medicine was coming from physicians, and there were very few nursing scientists in this area at the time. So I went back to grad school, and then I decided, well, why don't I become the scientist who focuses on this area? A parallel problem that I saw was that nurses were also very unhealthy and stressed, highly stressed, particularly new graduate nurses entering the field. It's an emotionally draining and complex profession. High stakes are on the line. You're dealing with life and death in most situations in the hospital. And nurses graduating from nursing school are, maybe 21 years old. Not that age is a particularly important variable, but particularly that first year in practice, there's little to no support for emotional well-being for nurses. So my concern about wellness and then my concern about nurses' health, I decided to apply for my PhD to focus on improving well-being for new grad nurses. What's funny is that I almost was laughed out of every PhD interview, not because I wasn't a qualified candidate, but because the people who interviewed me couldn't understand why I wanted to study nurses' health and well-being. And my advisor, where I ended up attending Northeastern University, and one of the major reasons why I selected Northeastern is because she believed that it was a crisis, but she said, we're not ready for it. Our profession isn't ready to address it, and there's no funding in managing nurses' health and well-being. So I have funding in cognition. So why don't you take your concept of holistic well-being and focus it on preventing cognitive decline in older adults? And someday you can circle back to this research idea. And so that's what I did.
I am truly stunned to think about how little people thought that this was an issue. So some of this must have been the time, 20 years ago. And as you were talking, I was thinking, I'm not sure I have a great definition of wellness. So maybe that's the other part. Maybe you could help me out here and tell me what you mean by that. And then we can put it in the context of your research.
Sure. I've used Hetler's 6 dimensions of wellness theoretical framework, which is physical well-being, emotional well-being, intellectual well-being, occupational well-being, social well-being, and spiritual well-being. And there are behaviors within each of those domains. And, typically when we think about wellness, it is not unusual to focus on something like healthy eating, exercise, and weight. Whereas this model expands well-being beyond the physical realm. So let's say you're working maybe in a career or profession that's not aligned with your values, or you're in a toxic environment. A deficit in your occupational well-being will have a negative effect on your other areas of well-being, your physical well-being, your social well-being, and vice versa. So I used that model of well-being when I was studying cognitive health in older adults.
So that's really interesting, right? Because it's detailed, but really broad. And it strikes me as incredibly difficult to measure well for any population. So let's dive right into your research. How do you take that definition and apply it to, which I assume now, like the aging adults is great, but now you're actually able to do research on nurses and the nurses profession, which is wildly. I'm going to include a bunch of links in the show notes about where to find your work. How do you try to cover those areas in a way that you can actually measure and improve on?
It's an excellent question, because when I was in my doctoral program, I was very naive about how difficult this would be. And the question drives the method. And what ended up happening to me in my dissertation research is I had to develop a method to measure wellness. And I ended up conducting a rash analysis, which is actually a psychometric process, which one may study. My statistician I work with now, he laughed the first time we ever met when I told him I was going to conduct a rash analysis. He's like, I am a statistician, and I would never have gone down this rabbit hole for my dissertation research. But it's what had to be done because there wasn't anything at the time that I could use to answer my question, because I wanted to see which domain of well-being had the most significant effect on predicting cognitive health in older adults. So I had a wellness tool that I was using, but it couldn't weight the domains accordingly. So I had to develop a measurement to weight them. One of my chapters in my dissertation is actually the rash analysis that I conducted on this instrument so that I could weight the domains. And then after I finished that, I ran models to determine which domain was the most significant predictor. And I found that emotional well-being was the most significant predictor of cognitive health in older adults.
Okay, so how does that apply to nurses?
Well, I was very deep into aging adults and examining how we could improve cognitive health, because another study I did on older adults' most important goals as they age found that their most important goal was to maintain independence, which to do so, you need to have cognitive health. And then I started testing interventions on how do we help older adults maintain their well-being so that they can maintain their independence. And I ran gardening studies, and I actually became quite passionate about this research, even though I really wanted to research nurses' health. Well, then COVID came, and I was the director of the School of Nursing at the time. COVID changed everything for the good and the bad in our profession. And we were about 15 months into COVID, and we're not designed as human beings to undergo that much of a sympathetic stress response for the sustained period of time. And what was happening is faculty were emotionally drained, students were emotionally drained, and I felt like throughout the whole pandemic, we had absolutely responded to the highest level as a school. We were responding to calls for support, for outbreaks, and vaccinations, and we were redesigning our curriculum. We were training first-year students to inject vaccines. But what I realized in that moment is we had a new crisis on our hands, and it was burnout and psychological distress, and I did not feel equipped to handle it. And I remember sitting in my office one day thinking, this job, the needs everybody I'm serving right now are beyond my capacity. I do not have the correct skill set for this. And I felt extremely overwhelmed by what I was facing. And interestingly, at the time, I don't know, maybe that same week that I was having these feelings of overwhelm, there was a grant that came from HRSA as part of the Lorna Breen Act. And Lorna Breen was an emergency room physician who committed suicide during the pandemic. And her family started a foundation in her memory to advocate for health professionals getting the help they need for their well-being, because in some states and in some professions, it could work against your license if you reported a mental health issue. So with this funding, they were asking for calls for evidence-based interventions to measure and address burnout in health professions. And one of the local hospitals reached out to me to partner with them. We were having a roundtable meeting on Zoom, of course, about the different ideas that we could pitch for this proposal. And I pitched essentially the same proposal that I had pitched when I was applying for my PhD. After I was done, everyone looked at me and said, well, Kelley, you should submit your own grant, because there were two different calls. One was for health care organizations and one was for academia. They're like, you should submit that for nursing students and faculty. And I said, and remind you, the grant was for addressing burnout and mental health. I said, I can't, I'm too burnt out. And they said, no, you submit your grant, we'll submit ours, and we'll bring all this money to our area to improve burnout for our health professions. So I did my part. They ended up not applying, and we got the grant. And so that was a real pivotal moment in my career, because I was able to focus on what I was truly passionate about, and it was just a jump start to one of the most professionally rewarding experiences that I've had to date.
Before that, were you still working on aging?
Yes.
Interesting. So this crisis gave you the opportunity to go back to what you had originally wanted to. I'm curious, are there analogous situations where nurses in particular are in this crisis mode for a really long time? I'm thinking like the TV show MASH, right? Where in a war situation, all the medical people are in this crisis all the time. Is that analogous in some ways to what you think happened with the pandemic? Or are there other situations that you could turn to try to help frame how to address it?
Are you asking, did the ongoing crisis fuel a new solution? Or are you just asking about what the ongoing crisis did to the profession?
What a great question. I'm asking if once you got the grant, did you look back in history to see if there are things you could learn to apply to the current situation?
Interesting. I didn't, but that's in part because everything felt like an emergency. So the way I handled the grant is I had knowledge on current best practice for, let's say, physical fitness. We know that engaging in exercise supports mental health and well-being. We know that. We know that a nutrient-dense diet is good for mental health and well-being. We know that. So I had originally knew I wanted to include those two pieces as part of our intervention. The piece that was new and we had to turn around quickly because this grant call was a 6-week turnaround. And fortunately, I work with an amazing librarian, is we pulled meta-analyses on the best intervention to address burnout in nurses or nursing students. At the time, there wasn't a lot for nursing students. But the intervention that came out in these meta-analyses that we pulled was mindfulness-based stress reduction. So I included that in the grant proposal. We would do mindfulness-based stress reduction. We would develop a fitness curriculum and a nutrition curriculum. And the funny story there is that in these grant turnarounds, that can be fast turnarounds like this, I trusted the science where the science was, but to be honest, I didn't fully understand what MBSR was, mindfulness-based stress reduction. And that was really our primary intervention. So That's how I handled it. It was more, what do we know now? What are we going to do? I didn't look back in time, and I didn't have that kind of time on my hand.
Sure, right. I mean, that's a luxury to be able to say, this is what we knew in the past. This is what we're going to build on. I was just curious about that. The pandemic was so life-altering in so many ways, and there are hard ways to find analogies to that. I was just curious if that was something that you'd kind of happened upon more than anything else. So let's get into mindfulness. Why did you pick that as your primary thing, even though you didn't really know much about it?
Because that's the science to date. And, I think an important point about science is best available information. It's always changing. And when we conducted a search in the databases with a librarian, we pulled the meta-analyses, mindfulness-based stress reduction had the most statistically significant results to support its effectiveness at reducing burnout for nurses. So we selected that intervention as our primary emotional well-being intervention. And what's really fascinating is when I was studying aging, I found emotional well-being was the most predictive wellness domain to protect cognitive health in aging. And then I found myself right back in emotional well-being is critical for nurses and nursing student health and well-being. And what I learned over the past 5 years is that adolescents are really struggling emotionally. And at our institution and our nursing program, we are predominantly serving emerging adults. So students between the ages of 18 to 23 coming right out of high school. The Surgeon General has published a warning on adolescent mental health and well-being. And we certainly anecdotally were seeing it, but then our data also showed. So I thought, okay, we're going to present these interventions. Students are telling us all the time they're stressed and overwhelmed, and they're just going to come. And that's not what happened. The other interesting finding that we had out the gate, so we conducted an emotional health profile of our population just to kind of see where everyone was at. And a surprising finding to me at the time was that 80% of our incoming first-year students were already at a high rate of burnout based on our valid and reliable measures that we were using to measure burnout. So they are coming to us burnt out. And then what was happening is each year in the program, they get a little more burnt out. And by the time they graduate, almost the entire cohort is at a high risk of burnout. Then we send them into the workforce, but all the attention on burnout is at the workforce point of contact. So everyone's blaming the workforce. And I'm not saying the workforce doesn't have a lot of work to do in addressing their own cultures and burnout. But the problem starts well before nurses and healthcare professionals enter the workforce. And somebody along the line has to own this. And it's quite radical because what we're learning is students, they'll tell you like they never have been taught that they could be in control of their own stress and well-being. Like these strategies that we teach them in many ways are foreign. Like they've never heard of it. Not everybody, but a predominant amount of people will say this. So anyhow, this really changed the plan for us because originally we were going to implement mindfulness-based stress reduction as a required course in the curriculum later on, close to when they enter the workforce, because we really thought the problem was there. And what we realized quickly is, oh no, we need an intervention before they even begin our program, when they're coming, right before they enter. And so we changed gears almost immediately.
So what does that look like for incoming students who are in the nursing program? How do you address this and get that going?
We did conduct a study on the effectiveness of mindfulness-based stress reduction, and we compared matched controls to students and faculty who participated in MBSR, and we saw statistically significant improvements in burnout, stress, well-being, satisfaction with life, and mindfulness with MBSR in our student body population. However, simultaneously, 5 of us were in mindfulness-based stress reduction teacher training so that we could sustain our grant efforts and continue to offer this curriculum. Because in the beginning, consultants were teaching our courses because there's only one other certified MBSR teacher in the state of Maine. So our grant was amazing because we were conducting research, plus we were building this infrastructure for sustaining a long-term program to support emotional health and well-being for students, faculty, staff. But during the training, what we learned is that mindfulness can trigger trauma response. And mindfulness-based stress reduction may not be the best intervention for people at certain points in their life, maybe a recent trauma, active depression, etc. So we didn't want to mandate MBSR as a class because we also know that all of our students, essentially, we were treating as having experienced a traumatic event because of COVID. And most students have had some sort of trauma, so we didn't want to force this onto anybody. So what we did instead was the university was launching a program that was funded through the Harold L. Foundation Research Learning Experiences, where students come to campus a week before the semester starts and they engage in research. And we decided to capitalize on that time and that movement at the university and intervene with a 6-day evidence-based mindfulness curriculum. We're using Learning to Breathe, which is a mindfulness-based curriculum that can be used for middle school or high school students, but I've adapted it to college students. And we run them through 6 days. So every morning they start their day with a mindfulness session. It's meditation, but it's more than meditation. It's learning about how your body responds to stress, learning about what to do when you're feeling stress, brainstorming a variety of strategies from taking a walk, journaling, walking away, turning off your cell phone. Then we take them through a fitness curriculum that was developed by one of our doctoral students in clinical psychology. It's a mindful fitness curriculum that also simultaneously orients them to the campus fitness environment, the rec center, the trails, the gardens, the climbing wall. One of our doctoral students in dietetics developed a mindful nutrition curriculum that focuses on nutrient-dense foods, but mindful eating and noticing how your body is responding to foods, textures, tastes. There's daily yoga. Then we have college readiness as part of our curriculum during that week. We talk about organization and how time management affects stress and well-being. We also give them a really fun campus scavenger hunt where we send them to places on campus that will support their overall success as a student and their well-being. The counseling center, student accessibility services, the library, their advisor. And then they take a research class. And in this class, we support them in the development of a research question about their own health and well-being that they want to engage in throughout the semester. And we format it in a clinical research question. So let's say, what does the effect of 2 minutes of journaling before bedtime, 5 days a week have on a first-year nursing student in 3 months? That's an example of a question a student came up with. And when the week is over, they start classes. And then I developed a course. It's a 1-credit course that runs the whole semester that gives them booster doses of the strategies they learned throughout the week. But it's formatted in a research class. So they learn the basics of research, how to create a research question, which we do every week, the difference between qualitative and quantitative research, different types of measurements, analyzing your data, graphing your data. But each week, these research topics are couched in well-being interventions. And I'll show them research. Like, for example, there's a gratitude letter research on a 7-minute gratitude intervention that has been conducted as part of a study out of Duke University for healthcare workers, where participants are asked to write a letter to someone they're deeply grateful for, that they have not expressed their deep gratitude, and write as much detail as possible in 7 minutes. And then at the end of the exercise, they're asked to share that letter with the person. So there's research published on this. So we'll walk through the research. We'll talk about, is this quantitative research? Is this qualitative research? And we'll have a broader discussion about the research and the findings. And then the students will actually engage in the exercise. They'll write the 7-minute gratitude letter. And part of their homework is to share the letter. Throughout the course, they collect quantitative and qualitative data on their research question. So they may track weekly screen time usage, step counts, if they're using a Fitbit, heart rate, HRV. Then at the end of the semester, we walk through how to create line graphs, and they write a lab report on their own health and well-being. It's been incredibly eye-opening. The students are actually very receptive to the interventions, and we do meditate. We meditate most weeks to start the class. And at first, they'll be like, I'm not the kind of person who meditates. And, I just read my course evaluations, and you wouldn't believe how many comments were, we should have this course more than once a week. I wish we had more meditation. I thought I hated meditation. I actually really enjoy meditation. So yeah, that's what we do. And now students can take mindfulness-based stress reduction as an elective course later in the curriculum. But this model actually allows them to kind of have a better idea of what they're getting themselves into, because the longest meditation in the first year curriculum is 15 minutes, which in trauma-informed mindfulness research, that is, short practices are the least likely to trigger a trauma response. And that's why we designed it that way.
This is amazing research. I'm wildly impressed that you did this when you were in fact burned out yourself. And also I feel the need to comment. I think the grant that allowed you to do the research, but also build the foundation for people in Maine to do it, is brilliant and exactly the kind of grant that just fosters all sorts of innovation and infrastructure building, and exactly how grants really benefit the population in ways that are unseen but really important. I'm curious if doing all of this and stepping through it also helped you with your burnout.
Yeah, it's a great question. And the answer is 1,000,000,000% yes. To circle back about MBSR, mindfulness-based stress reduction, we received the grant. I was extremely overwhelmed because I had also received another grant in July of that same year. And then this grant came through in December. So now I have 2 multi-million-dollar grants and I'm burnt out.
And it's still in the midst of COVID.
We're still in COVID. I have little kids. There was a lot. And I'm sitting on trying to build an entire program that I promised the federal government I'm going to do. And I'm somehow supposed to recruit participants to enroll in mindfulness-based stress reduction when I've never taken it. And I know just enough to be dangerous at this time. So we're sitting in a research meeting, and my colleague, who's a clinical psychologist who was also on the grant, she said, we all need to take the class. And I said, well, I can't take it right now. I'm too busy. And then she looks at me dead in the eyes as if she's speaking to my soul and said, isn't that always the case? We're always too busy to take care of ourselves. And I felt like there was no turning back. So I enrolled. And after the first class, I slept through the night, and I had not slept through the night in 4 years. And the class had such a profound effect on my life. I can't even begin to tell you all of the benefits that I've experienced, because part of the training to be a teacher, it's about 550 hours. It's not a simple training, which is something I also was not prepared for when I put this in the grant.
Sometimes it's better not to know what you're getting into.
Right? Totally. Because I don't think I would have signed up. Like, for example, we have to attend annual week-long silent retreats. That's part of it. I mean, there's didactic training. I'm completing my certification through Brown University. It's very much like graduate level classwork. It's an amazing program. In addition to the didactic training is, you yourself need to engage in these deep practices. So yes, I've been to 5 week-long silent retreats, which are extremely difficult, but I've never felt better when I'm at the end, physically and mentally.
It's really amazing. I'm curious if you've written a gratitude letter to your colleague.
Ooh, I should. She knows that I am grateful because I bring it up all the time, but I should write her a gratitude letter.
I have found it is really important to have people around you who cut right to the chase and say what you need to hear, and who you respect enough that you will actually hear it. And it sounds like that's what you've got with this colleague. Sorry, I don't mean to give you more work.
No. I do write the gratitude letters with my students. So this year I had 6 sections of first-year students, so I did write 6 gratitude letters myself. Everything they do, I do.
There's just so much here, Kelley. When you were talking, I was thinking this could go well beyond just nursing students, right? I'm curious if other faculty and other departments have said, how do we get in on this?
Another great question. Yes, they have. In the beginning, I was getting calls from all around the healthcare industry on campus. Oh, could we get this? And we just didn't have the capacity in the beginning. But when I got mindfulness-based stress reduction approved as a credit-bearing class at UMaine, so mindfulness-based stress reduction is a intervention. It's participatory medicine. It's a clinically based intervention. So there's a curriculum for it. But to get it approved as a credit-bearing class, of course, I need assignments and they needed to be approved and aligned with the university's general education requirements. So once I got that approved, I actually opened it up to all majors. So this fall, my class had students from math, wildlife ecology, education, social work, nutrition, nursing, and I also had faculty in the class as well. And I've also delivered some mindfulness curriculum to the College of Business. I've also talked with the College of Ed about potential support for them as well. Because, as you said, this is really burnout is a societal crisis. It really is. I've been focused on nursing, but the more I'm learning about burnout and the more I talk to people, it's not isolated just to nursing.
No, it seems to me that we've done a really good job. Just go, 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 go all the time. And maybe you see this more, but I am struck by, my kids are in their 20s and they're much more aware of it and recognize more than like my age, the need to step back sometimes and say, I need a minute. And whether they have all the tools or not is not necessarily, that's the next step, of course, but even recognizing it, I think, is beyond what certainly I was brought up with, and people probably 10 or 15 years younger than me as well. So I do think it's really interesting that you have established this really great program, and it's super evidence-based, right? I've lost track of how many times in this conversation you've said science, which I didn't even ask you to, so that's pretty awesome. But deeply researched, and you can point to results and how valuable it is. And while it's clear that your passion is for nurses, it strikes me over and over again as you've been talking where this could apply in many other situations.
And the science started elsewhere. You said earlier in the conversation, well, if you look back in history, what were the parallels with COVID? Mindfulness-based stress reduction was developed by Jon Kabat-Zinn after he attended a week-long insight meditation retreat at IMS, which is the same place that I've attended retreats. And it's so fascinating now because when I attended my first retreat there, I was like, oh my gosh, I see how he saw this. He's brilliant. He's an MIT PhD, brilliant man. But in 1979, he developed this program. And from the get-go, he conducted empirical research on its effectiveness. And what he said, so he's working at UMass Medical Center, he asked the physicians to send him all the patients they couldn't help. And he ran them through this curriculum and tested its effects and evaluated its effects. And the volume of research dissemination on MBSR outcomes over the past 10 years has exploded. So we're using this in the context of education and nursing students, nursing faculty, but it has been studied for pain, addiction, on symptoms of chemotherapy, radiation. I could go on and on and on. There's so much research on MBSR and its use for addressing one's response to stress and emotional well-being.
So I'm not sure this is a fair question, but I'm going to ask you anyway. Is there anyone doing research to figure out what's going on in the brain to make this work?
Oh, definitely. So there's research on the effect of mindfulness meditation on the amygdala, and MBSR and mindfulness affects neuroplasticity, which is your ability to rewire your nervous system pathways. Like simple examples we talk about in class is you walk into a room and you feel nervous. So immediately you pick up your cell phone. And what you've done right there is trained your nervous system pathway that when you feel nervous, you look at your cell phone. And then you hit a dopamine. The dopamine is a feel-good hormone. And then the dopamine sends a reward to your brain that reinforces this habit loop. With mindfulness and MBSR, one of the techniques you learn is a body scan. And within the body scan, the intention is it's a mindfulness meditation practice where it's typically done lying down, but you could be seated. And you're guided through focusing on specific parts of the body from the feet all the way to the head. And the invitation is just to pay attention on purpose to whatever's there. Temperature, maybe discomfort, maybe nothing. And place your attention on purpose, non-judgmentally. It's not a time to complain or have all these judgments about what the body does or doesn't do for us, which is our habitual response typically. Like, why does my body look like this? Why can't it do what Jimmy's body can do? This is a foundational practice in MBSR. is the body scan. And you practice this week over week. And one of the huge benefits of that is then you can pay attention to when your body has sensations of anxiety. How does anxiety show up in your body? Or how does anger show up in your body? Because awareness is extremely powerful. So once you notice that you're anxious, you can name it to tame it, which is another strategy we teach in the class. Like, I am anxious, and then I choose what I do. So going on my cell phone is an avoidance, which is a maladaptive coping response. So I can sit down and introduce myself to the person next to me because social connectedness is incredibly important to well-being. So every time I choose a different response, I am then rewiring my habitual response pathway in my brain. I mean, that's just a snippet of some of the stuff we talk about.
I could literally talk to you for hours and hours about this and have it become its own little class for me. But before we wrap up, we had talked about this before we started recording, and I actually think you've probably answered this as far as I'm concerned, but have been having recent guests just talk about the value and the importance of basic research and also federally funded grants. It's pretty clear to me, you said your burnout load maximum because you got two multi-million-dollar grants within a couple of months of each other, which is like, great. And also, right? Because now you have these obligations. But I would welcome giving you the floor, so to speak, to talk about why this type of work is so important and why having it funded by what is not a profit-driven motive is so vital for research and science and community.
That's a great question. Federal funding for the nursing workforce is deeply personal to me. I was born to a teen mom and was raised in a family of generational poverty. I was the first person in my family to go to college. I was funded through a federal HRSA grant for my PhD. I received full tuition and a small stipend, which was $15,000 a year. And I was most certainly meeting the definition of poverty, especially living in the state of Massachusetts. And to me, that amount of funding has a significant return on investment because I came back to my home state, to an area that has critical nursing workforce shortages. We're approaching a crisis level of faculty shortages in nursing, doctorally prepared faculty, not just in our state, but nationwide. And then I've gone on to secure more federal funding. And one of the other grants that I have was a nursing workforce diversity grant that actually provided tuition scholarships to first-generation college students with unmet financial need. And we funded at least 100 students through that grant. I cannot tell you, this is another shocking, which shouldn't have been, this is just me being naive, but a fact with that grant. For students who received $5,000, which is just $5,000 for a student, we actually flipped our retention and four-year graduation rate for first-generation college students. So our first-generation college students, so these are students who are coming to college whose parents didn't graduate from college. They were graduating on time at a higher rate as continuing education peers. So they were graduating on time at a higher percentage than students who come to college with parents who graduated college. And nationally, we do not see this. Typically, first-generation college students are at high risk for dropping out and certainly not graduating on time. And there's all that, we could have a whole other podcast about that. But this was just with $5,000 per year. And I shouldn't say just, because also, remember, we're doing this whole mindfulness curriculum and we're supporting students and we had other supports going on. But for nursing specifically, we constantly discuss the nursing shortage and how we're going to get more nurses. And often the knee-jerk reaction to that is we need to increase enrollment in nursing programs or we need to open another nursing program. Well, we have 15 nursing programs in the state of Maine and we can increase our enrollment all we want, but we don't have the faculty resources. We do not have the clinical site and we're not graduating students on time at a high percentage, period. Nursing curriculum and education, because of our national requirements, are so rigorous that our students who want to go back to school for nursing, on average, are in a classroom or a clinical setting 25 to 30 hours per week, depending on the time. That doesn't include the amount of time they need to study and prepare. We have very high progression standards. So if you fall below a 77 twice, it's a dismissal from the program. And for students who are coming from disadvantaged socioeconomic backgrounds, they have to work. And then most of our students work anyway. So offsetting this financial burden for them actually has a major impact on their ability to graduate on time. And I imagine if we could have given money to all students. If we really want to address this nursing shortage, we need to put our money where our mouth is, and we need to fund students' education to become nurses because they are struggling to do it all. And that it's part of our workforce issue is students not graduating on time because they simply can't. It's a major challenge. So we funded that. We have another grant in our department that's funding right now 100% nurse practitioner students who are in school full time, which has significant impacts on our state. We're a rural state with a primary care shortage. And this grant actually took our enrollment. We had such low numbers in our nurse practitioner program. Now we're full because of the funding, because funding matters for the health disciplines. It just does. Especially nurses who earn high salaries, to go back to school to earn a higher level of education, often to not make more money. It's not a motivating financial situation. So federal funding has significant impact on all people. And you think like, oh, whatever, we're in a nursing shortage. Well, when someone you love is sick, has a life-threatening emergency, gets into an unexpected car crash, has a stroke, a heart attack, the list goes on. You want to be confident when that ambulance shows up at the hospital or you drive them through that hospital door. There is the most qualified, compassionate nurse and entire healthcare workforce, not just nurses, but all health professions are there for the person you love. And you don't know you need it until you need it. And it's not something you should gamble around with. I can promise you that because health is everything. If you don't have your health, you have nothing.
Perfect. That's a really good synopsis of what we need and what's at stake. All right, Kelley, I will not make you talk from now until the beginning of the semester about how incredible the work is with the mindfulness, but it has reminded me of a desire I've had to go back to that myself. So now I'm inspired. The mindfulness really is something that we can all do to really just take a minute. I love the research you're doing. I'm really grateful that you've been able to get back to your passion with healthcare professionals. Not that the aging isn't important, but to be able to do what you got laughed out of for so many graduate interviews is really great perseverance on your part. I'm super impressed. I appreciate the work you're doing for the state and for the students at the university.
Thank you, Kate. It's so funny because when we first started mindfulness-based stress reduction training, the research team, we would have a discussion about the teachers who train teachers to become mindful. And we're like, it's too much. That's too far. And then the other day, we just submitted a systematic review on MBSR in nursing education. And one of the grad students and I were talking for like an hour just about mindfulness. And at the end of the call, I go, oh my gosh, we are one of them now. We are.
Thanks for listening to the Maine Science Podcast. Make sure you never miss an episode by following us on your podcast platform of choice. And please leave a rating and review. It will help more people find us and help spread the word about some of the remarkable people doing science in Maine. The Maine Science Podcast is recorded at Discovery Studios at the Maine Discovery Museum in Bangor, Maine. The Maine Science Podcast is executive produced and hosted by me, Kate Dickerson, and edited and produced by Scott Loiselle. And the Discover Maine theme was composed and performed by Nick Parker.